It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
People, thank you for joining me with another episode of Spill With Me, Jenny D. I'm so excited. I'm here at FeelNu on Steubenville Pike. Like
Yes.
I'm out in, I think, what township are we in?
Robinson
We're in
Township.
Robinson Township. I'm so excited. Kym Gable here. Kym, introduce yourself to the listeners and the viewers.
Yeah, it's cool to be on location today, right, Jenny D? I know. So yeah, I'm Kym Gable. I'm one of the hosts this year of the brand new reimagined Pittsburgh Women's Expo. It's on March 22nd at the David L. Lawrence Convention Center. And one of the reasons we're here is because Dr. Vinarski here is playing a big role in that expo.
Yes,
and it's Women's History Month too.
I'm happy to do it. Yeah.
I know. I so appreciate it. Dr. Vinarski, introduce yourself. Tell the listeners and viewers who you are and what you do.
So my name is Irina Vinarski. Okay, I'm a founder and physician of medical spa, FeelNu and the Aging Medical Center. So what we do is mainly wellness and prevention. So we do a lot of hormone replacement therapy, weight loss therapy, aesthetic procedures, pretty much make people feel new. You know,
Yes.
feel
Now
new
that's what the
inside and
title,
out.
right?
Yeah, right.
I love that. Now, how long have you been doing this?
I've been doing it for about 26 years.
Oh, wow.
Yeah, since 2000.
Look how young you look.
Right. So since I came out of residency in 98, I did conventional medicine for a few years, but my biggest passion was always help people actually feel better, not just, get their numbers better, but just feel better, look better. And that's how I got into anti-aging medicine, which is does involve a lot of spectrum, a lot of sides.
Yes.
Yeah.
I think that
Yeah.
nowadays a lot of women, especially in their 40s and
Mhm.
50s and 60s,
Right.
they're just really like, help. I need help with the hormones and
Right. Yes.
just looking younger and
Mhm.
feeling younger is
Yeah.
really the hard part. So I'm just going to ask you a couple
Sure,
questions
of
that I
course.
have
I'll
here
be
in case
happy
the
to. Yeah.
listeners and viewers want to get
Yes.
to know. So, like, what inspired you to get into medicine? Focus on wellness and weight loss. What really inspired you?
Interesting enough that I always wanted to be a doctor since I was like 10, 12 years old. Medicine was always a big interest for me because I feel like you can do so much. You really can play such a big role in people's life. So I have patients that come to me for like almost 25 years. I know families, I know everything about them, almost like family, I would say,
Right.
and it's very nice to see transformation.
Mm.
Somebody, let's say, would come to me 200 pounds, for example, in a deep menopause, not feeling good, and you see how they improve, months after months, and they feel so much better, they sleep better, their mood is better. So even relationship in a marriage actually gets better.
Oh, yes.
So
that is
it's
one of my questions.
just
true, yeah.
absolutely amazing. Yeah.
Right. And, I almost said to this to a couple of my friends, like, I feel like we're starting to talk about premenopause
Yes.
and menopause
Yes.
now. Like, I
Yes.
don't feel like my mother ever talked about it. Like, right?
They
didn't.
talk
No.
about that all the time,
Yeah.
right? Yeah.
I wish I knew.
Right. It's
Right.
like a
It's
subject
too late
that
for me
nobody
now.
talks about.
That's how I feel. I
Too
feel
late
like
for
Too
you.
late for me.
You're so young. Why is it
I
too
know,
late
I'm
for you?
postmenopause.
I
But
I'm
know.
postmenopause too.
You're
know
postmenopause.
that
That's good.
menopause is forever.
Yes.
I'm
right.
like, thank you,
right.
Mom, for
Yes.
letting me know this information. But feeling good in your skin, and like you said, the hormone imbalance. I mean, I feel like a lot of women have been crying for help.
Right.
It's like,
Absolutely.
what am I doing? Why am I so miserable?
Why?
Like,
Yeah.
why am I gaining this extra weight?
Right.
Especially in the
Yes.
mid area, I feel
And
like.
anytime you drop your estrogen level, you develop what we call insulin resistance, which is a big problem actually in this country, partially due to diet, but the menopause completely eliminates, that protective mechanism that estrogen has. on insulin metabolism. So when insulin level goes up and we become insulin resistant, you instantly get a tire around your waist,
Oh,
and also metabolism drops down
right.
because your testosterone level also goes down. So a lot of factors involved, not just one or two. It's very complicated,
Right.
but yes, it happens with menopause.
Right, because we're all so
Really,
different.
yeah,
Yeah.
right,
And
yeah.
doctors never told us that. I mean,
Yes,
10, 15 years
right,
ago, even your
yeah,
OBGYN, there was never an explanation as to
absolutely,
why. It's just,
yes.
well,
Yeah,
that's
it
the way
is
it
what it
is.
is. You're just
Yes.
told, you're just
Right.
told and just deal with that. We do not have to deal with that. We can actually treat it,
Oh,
improve it, and actually be happy even at our age,
right.
Yeah.
I know I
Mhm,
started a Menopause Monday series because I was
mhm,
like, all right, listen, I don't want my
mhm.
daughter to go through what I'm
Right.
going through,
Yeah.
and I'm like, we need to talk about this. And
Sure.
every woman is different,
Oh, yes.
right?
No
I mean, you
questions
find that.
about it. Absolutely. Every human is different,
Right.
you know. And what I want to say is like, it seems like women are definitely somewhat underappreciated in that specific topic.
Right.
When I drive, I hear advertisements all the time. If you're a man, if you're older than 50 and you have ED, go do this, do that. What about women?
Right.
What are we supposed to do,
Yes.
And like you mentioned, some people think menopause is hot flashes.
Yeah, right.
No, that's actually not menopause. That's actually perimenopause. That actually means that your estrogen is fluctuating. It goes up and it goes
Okay.
down. That's when you get the hot flash or night sweats. Menopause actually is a condition when you don't make any hormones, when your estrogen drops down completely down to undetectable level. That's an actual menopause.
Oh
And
my
it
God.
continues
See,
for the
I
rest
didn't
of
know
your
that.
life. Yes.
No, I didn't know that
I'm
either.
learning
Yeah,
something
yeah,
new right now.
Yeah, because I mean, in
yeah.
my 40s, I don't know if
Mm,
you felt like this, Kim. Is I was just, I was so depressed, and
really.
I think that it was, and I was like, why am I so unhappy?
Mhm,
They, prescribed anxiety medicine,
right.
and to come to find out, it was probably
Most
perimenopause
Mhm.
likely, yeah.
because I
Yes.
was having like 2 periods a month
Yeah.
or no period, so it
Mhm.
was like,
Yeah,
what is going?
hormonal imbalance.
Yes,
Yeah, that's not even payment, it's imbalance.
right.
And we usually start having some imbalance after 40.
Yeah,
And
that's true.
each hormone is unique. Like, for example, when you're lacking progesterone, you become anxious and you don't sleep well. And the typical symptom is you fall asleep and you wake up multiple times, or you just wake up and you don't fall asleep again. And
Yes.
it can be easily treated. Progesterone, a natural micronized bioidentical progesterone, is
Right.
extract of yams. It's not even a real medication, so you can take it at night,
Okay.
sleep much better, much deeper, and you can feel less anxious when you take it for a couple weeks.
Oh wow.
Instead of taking antidepressants, which actually doesn't treat any problems, it's just a band-aid,
Yes, a
Yeah.
Band-Aid. I
Mhm.
love how she said.
Right.
So, do you do estrogen here? Like, do you
Yeah, we do
HRT
all
here,
here. We
hormone
do.
replacement
We
therapy?
do a full replacement, of
Okay.
course, yes.
Yes.
And some people need full replacement. Some people just need to adjust their hormones. It depends on what age you are and what stage in life you are. If it's postmenopausal, real menopausal patients, yes, you need full replacement. But if you're, let's say, in your 40s and you're still not in a, complete menopause, you might just need one or two things. That's it, you know?
Yes. Yeah, because I mean, the
Mhm.
lack of sleep to
It's
me,
the sleep.
Oh,
Yes.
yeah,
I
yeah,
mean,
Yes.
yeah.
it's
Mhm.
horrible as
Yeah,
as a woman,
right,
it's like I can't function and
right.
the whole day. But I
Mhm.
do wake up in the middle of the night. So when you were saying that, I was
Yes.
like, I need more progesterone.
Right. Progesterone, like translation from Greek, means life. So you're
Oh my,
lacking
I'm learning so
progesterone.
much.
You're
Mhm.
lacking life pretty much,
Wow.
Yeah.
So
Mhm.
okay, so we were talking about the weight, the
Mhm.
mood, the
Yes.
energy,
Mhm.
especially because we lack the energy as we get older.
Mhm.
What are some of the things women can do to take control of their health before menopause hits? I mean, you said
Mhm.
like so. Say for instance, they
Mhm.
always say 10 years before.
Mhm.
What is that? Before your period started, or what is that?
Before your periods end, you mean,
Yes,
or
before your
before
ten
periods end?
years before your period.
Mhm.
How would you even know when it would?
Right.
You know what I
Yeah.
mean? Like
So I would say actually that we always have to keep ourselves healthy. Watch your weight, watch your diet, always exercise. I'm a huge fan of exercising.
Mhm.
And any time I talk to any patients, doesn't matter what we do, what they came here for. but we talk about different kinds of exercise, weightlifting, cardio. Without that component, you can't achieve anything, even if it's anxiety, depression, whatever. That's an absolutely necessary thing. You can start checking your hormones at age 40 or even prior to that. It doesn't necessarily mean that you need to take something, but you can at least start testing.
Like blood work?
Like blood work, yeah.
Okay.
Yeah, occasionally we do saliva test if we need like a really deep type of, understanding of somebody's hormones. But usually blood work is, efficient,
Yeah,
good
and I
enough.
think that, like, I don't know about you, Kim, but I think that what happened was too is like a lot of people were afraid to do the hormone replacement because they
we
said
were
it
told,
caused cancer.
Right.
we were told that it
Yes.
had negative implications on our
Yes.
health and our
Which
bodies.
really doesn't make any sense. I always give you that example. Like if you're pregnant 10 times, does it increase your risk for cancer? Like just think about it. No, it actually goes down. So
Right.
pregnancy is a state when you produce 1,000 gram of progesterone, enormous amount of hormones, estrogen, progesterone, everything.
Right.
And it makes you have less chances to develop cancer.
Oh my gosh.
I mean, it does lower the risk of cancer tremendously.
Right.
So the point is, I don't think that hormones can increase risk of cancer. Actually, FDA took off the black box warning on estrogen right now. And the study that was done in 2003, Women's Initiative study, was completely misinterpreted. The study showed that estrogen does not cause breast cancer or increase risk of heart attacks. It showed that progestin, synthetic form of progesterone, increases all that. And who knows what happened?
Yeah.
I don't know. It was taken in a completely wrong kind of,
Right.
So it's the interpretation
of it that
was misguided.
Misguided,
Yeah.
Yeah, and it took 25 years to,
And to your point, you used the word underappreciated a little while ago.
yeah.
It's also underfunded and understudied.
Right.
All of those things.
Right.
And then when you have a misinterpretation like that and it just gets out there and it blows up, I mean, it's
exactly.
And the whole thing with testosterone too, like, as
Oh,
women,
yeah,
we don't
that's a
feel
big,
like we need as much as men, but is there a testosterone for women?
Yeah, absolutely. Like I'm myself postmenopausal for 9 years. I do a full hormone replacement. And I always say, if not that, I wouldn't be here. Because menopause affected me horribly, like literally real bad. I felt very good before my menopause and really bad when it hit. So I'm on a full replacement, including testosterone. What is testosterone? So female dose of testosterone, not male. Okay, that's what we do. And testosterone is a pure bioidentical, which means identical to your body hormones.
Okay.
And what does it do? It increases your energy. That's the one actually that makes your energy go up. It also helps with aches and pains. I see people with fibromyalgia actually feeling completely normal on testosterone replacement, very small dose.
Right.
It also improves mood, improves libido. So relationship, again, that's what I mentioned. In a marriage, they get so much better.
That's so true, yes.
Right. And you can work out much more and you can recover better. So it's like a cycle, You start replacing testosterone, it leads you to other good things,
I was so afraid to take it. I thought I was going to grow a beard. I already have all these little pieces of hair down there.
Again, the things we were told, the misrepresentations.
So, Dr. Vinarski, tell us what else you do here. Besides, you help with the weight loss, and you do have a lot of patients that are going through perimenopause and menopause. But what else?
So besides aesthetic procedures, which we also do a lot, we also use peptides. And the peptides is something that everybody talks about now.
Yeah, right.
And nobody knows what they are.
No.
They think it's a skincare or something like that. Right.
Well, it seems like they're in everything. Everything has peptides in it, or at least that's being advertised.
No, it's not.
So.
Peptides are all injectable. Okay, that's number one misconception. Yeah.
Right.
Peptides are injectable. They're a chain of amino acids. They're all very highly specialized. Okay, so there are about 7,000 peptides known in the world right now. In United States, we probably use around, I would say, close to 100 so far. But all peptides are usually used for one specific reason. They don't interact with each other. Okay, they like usually don't have any side effects. Peptides are completely natural, something taken from your body. Okay, like let's talk about oxytocin. It's a good example of peptide, and actually it's a hormone, but hormones have peptide structure, so you can call it peptide.
Okay.
So oxytocin is produced when we breastfeed and orgasm, and it's a hormone or peptide of happiness. It makes you happy, and it's natural. So if you take that exact sequence of amino acids and reproduce it in a lab, so you get what you make yourself. So you pretty much give yourself what you do make. You just
Right.
give it more.
Okay.
So it makes it pretty safe because, like, usually what you make yourself is not bad, right?
Right.
And it's used for anxiety and depression, and it's actually a wonderful treatment. It comes in nasal sprays. There is an injectable form, yes.
Wow.
Right.
And so those are some of the things you do here as
Right.
well.
Yeah,
Yes.
yeah. There are peptides for joint pain, for arthritis, for healing, pain management.
Right.
There are some people that we took off opioids and put on peptides, and they're doing extremely well. Neuropathy,
Oh my
I
gosh.
mean, all kinds, sleep, just name it, and it will be a peptide.
Well, I mean, the osteoporosis, I
Yes.
remember I talked to somebody about this,
Mm.
one of my friends, and she said, do you know any male that has
Yes,
osteoporosis? And I'm
yes,
like,
yes. Yeah.
really? They do?
Yeah.
Oh, I thought it was mostly in women, but is it because of our
No.
bones? Like
So
maybe,
in men, they do make obviously much more testosterone,
Right.
So osteoporosis is an issue of menopause.
okay.
Men also get menopause. We just get very sharp one. We drop.
Right, yes.
Men go like this, slow.
Slow.
Yeah, their testosterone goes down. But without hormones, we do develop two things: osteoporosis and osteoarthritis.
Mhm.
Oh.
You never get osteoarthritis before menopause. Never. No, do you know anyone that gets?
No.
No.
Well,
Yeah.
I have a friend that actually she had to get a hysterectomy, so
Mhm.
she went into menopause like 30 years old,
Mhm.
so quickly. Do you have patients that come in that have been through that you
Yes.
help?
Sure, of
treat?
course, yes,
Yes.
yeah. We don't discriminate any ages. Yes, if you don't have, obviously, if you're not producing any hormones, you need it. And younger you are, you need it more.
Right.
Yeah.
Yeah, because I think some
Like,
of her
yeah.
doctors said not to take the hormone replacement,
Oh,
and then there's
no.
other doctors that say it, so I think that made it really hard for her.
It depends if she still has ovaries left.
She doesn't.
Maybe, she doesn't.
Yeah.
Then she definitely needs it. Because imagine 10 years from now, what is going to happen to her? The biggest amount of receptors for estrogen is on your brain. That's an area that suffers the most.
Oh my gosh.
It's
No wonder we
another
get brain fog.
brain fog, memory problems.
Yes.
That's another point. You never develop dementia before menopause. So that only happens after. Why? Because we lose that stimulation. In men, it's testosterone. In women, it's estrogen. Yeah.
Kym, did you have a question?
So how
Mm.
long, here's a question for all of us postmenopausal
Yes.
ladies. How far postmenopause is too late to start some of these therapies and treatments that you
That's
offer?
a
When
very
is it
good
too late?
question. Very good. It's never too late.
Okay.
So actually didn't know that myself, but now I have patients who are like in 80s and we treat them.
Really?
Yeah, maybe not the same amount, not
Yeah.
the same, frequency, whatever, but yes, it still benefits them.
Mm.
Yeah.
Wow.
Right.
These are things that we're learning. I'm learning so much just listening
Well,
to
yeah,
you.
Thank
and
you.
that's why we need to have knowledgeable experts in the
Yes.
field like this who have the real answers for us, right?
Right.
Sure.
And the weight, when we talk about the weight loss too, that to me has been such a struggle for
Oh, yeah.
women, 40, 50, 60, whatever.
Mhm.
Now here, what do you have? Like, do you have any shots, or do you guys do any
Yes.
programs with weight loss?
Right. We have multiple programs for weight loss, which includes obviously diet, exercise, counseling. We even have a psychologist that works with, women and men. We see men as well. Yeah, and we do use GLP-1, injections, various GLP-1, and we see them every few months or every month, so they're accountable. We do body scan, we check body composition. We always talk about weight loss, so that's a
Right.
good point.
Yeah.
It's not what we are after. We are not after weight loss. We are after fat loss.
Mm.
You want to lose fat, you want to keep your muscles. So we
So
check
true.
that in the beginning, right, to see what your muscle composition, your fat composition, and we follow that when they're done or in the middle to see if they're losing any muscles. Because if you're losing muscles, it's really not good.
Right.
Loss of muscle called sarcopenia, and
Sarcopenia,
sarcopenia
yeah.
actually defines aging. You know,
Okay.
as you get older, you lose muscles anyway.
Right.
So there are multiple peptides actually right now that can improve your muscle mass.
Oh,
You
wow.
can gain up to 4 or 5 pounds of muscles in 3 months with certain peptides.
Oh my gosh.
Yeah, if you use it in addition to the GLP-1 shots, you know?
Yes.
Yeah. So,
So if somebody's out there listening right now and they're like, oh, I need to see you. I need to, I need some of these. What would you say to them? Like
please come
how would
over.
how would they get a
Look at
hold
that.
of you? Like, would they be able to be a new patient? Are you taking new patients? And things like
Sure, of course,
Okay.
I'm taking new patients. I'm ready to see, you know.
Okay. So would they would go like on your website or call the number here?
Call, better
Okay.
to call.
Okay.
Better to
Yeah.
call.
And I'll have all that information on
Sure,
here.
yeah.
But Kim, let's, I don't know if we covered everything that you do here, but
Mhm.
Kim, tell us a little bit about like why we're here, and we're just so happy that us women
I
are coming
know.
together, we're collaborating.
Yeah.
That's
And
what we do.
it's about time. Yeah, it's about
Yes.
time to come together. And I love the fact that when women come to the Pittsburgh Women's Expo and they see our exhibitors like Dr. Vinarski, and you are our podcaster, our featured podcaster that's going to be there. I'll be there as well. But it's a time to learn from each other too. I mean, we're talking about, this isn't just going to be a exhibition hall full of different vendors and booths and people just sitting there. It's going to be an experience, and it's going to be a time for us to connect with each other, but also learn from each other too. And you are a featured presenter. We thank you so much for
Thank you so much for
being
having
the
me.
sponsor. Yeah, for
And that's
FeelNu.
another good point. We are always learning.
Yes.
This area of medicine is developing rapidly. You know what?
It is.
We didn't know any of that 40 years ago, right? Yeah. So it's a lot of new stuff coming. Almost like every month we have something new.
That's
It's fascinating.
There
right?
might be
Yeah.
something new in 3 weeks when
Absolutely.
you're at the expo
Now I tell you
folks,
something else,
the
right?
folks
Yes,
can learn from as
exactly.
well.
Right.
You can
Yeah,
share
yeah,
that with us
surely.
too.
I know, it's
Yes.
so true. It's like, which is great
Yes.
because I feel like, with women's health, we have been a little bit behind the eight ball, maybe a lot behind
Yes,
the eight ball.
yes, unfortunately.
I know.
But we're picking up.
We're picking up
Yes.
now. It's not too late,
yes.
like you said.
It's never too
It's
late.
never too late.
Never too late.
I think that a lot of friends that I talk to, they're like, oh, I don't have any symptoms. I didn't go through menopause. And I'm always like, we all go. Every woman goes through menopause.
And some women, I see that they're so used to feel bad that they don't know the difference. And it's very, very, sad, obviously, right? Because we are entitled to feel good,
Why spend like
Yes,
the next 20 years of your life
Mhm.
being in pain and
Right.
and not feeling
Yes.
good and not having the energy like you said, like
Right.
that to me is just like
We could be still productive and we could still be happy in menopause
Right.
or after menopause or whatever you call it,
yes.
It doesn't have to be a sad, unhappy
Mhm.
period of life.
Right.
It can be actually much better. Right?
Yes. The
Yeah.
things that we're learning here,
Right,
I'm
yeah.
just like, oh my God. Is there
Yeah.
anything else that I didn't touch on that we should talk about that you
I
have here?
mean, we
at
do
Feel?
a lot of aesthetic procedures, Botox, fillers, threads. We do threads. We do liposuction. We do laser procedures, chemical peels, facials, microneedling. So we have a whole list. Yeah, so it's not just inside, but outside also.
Yes. Oh, I love it. Like, so somebody can call and they can come in here and they
Right.
can get anything that's,
Consultation.
I was going to
yes.
say the consultations are
Mhm.
best.
Right. Of course, yeah.
Because that's when they say, okay, this, because I felt like that commercial with all the post-it notes when I went to see my doctor.
Yes.
I was like, I have this, I have that.
That's a
My
post-it,
hypochondriac.
okay. I should have that, right? I should have it on my.
I'm like,
Yeah.
my hypochondriac, because I
Yes,
feel like
yes.
I have all these symptoms, and I'm so happy that as women, that it's okay to talk about these things. And that's my biggest thing is now we're open.
Right.
Yes.
Right.
We're being honest with each other as women. A lot of
Another
times we
problem with
hide.
menopause, I believe you just brought another point. It's like you start feeling so miserable, and it's such a many areas of your body, and they're so vague. The symptoms are so strange. right? That if you talk about it, it almost feels like you're crazy. Kind of,
Yes.
oh, I'm anxious, I'm depressed, I can't sleep, my joints hurt, my brain is foggy, I can't remember anything. So what do you think it is? You're crazy, right? But it's actually not. You're actually in menopause.
I should have came to you.
Yeah, I know.
Right.
That's why I asked her if it was too late. So
It's too late. Yeah.
Well,
yeah.
Yes. Because as women, we're not supposed to. We're, some people are moms,
Yes,
caregivers doing
yes,
this, and they don't put themselves
right.
first.
That's a big problem for women. Yeah, they're always lost.
Yeah, and they don't want to put that money into something that is so important. Like, when people say, I had one friend, because I haven't slept in 10 years. I'm like, what is that?
Right.
You're not like, hello, you need to get that checked.
Yes,
And
absolutely.
it's almost like, I don't want to like tell them, you need to do this, you need to do that. But I'm like, you need to listen to these professionals that know what they're, because we're in that age where we're like, we're talking about it, we're doing something about it.
And everything is available. It's the 21st century. That's what I always say. You can actually, you don't have to live in the 19th century. You can actually move on. Right? Agree.
And it starts with conversations like these.
Exactly.
And it's important to go to an expert too.
Thank you.
Absolutely.
Yeah.
And we're so glad you're here.
Thank you so much for having me.
Men and women, and with everything that you're doing here, I'm just so excited about the Women's Expo.
Yes. Thank you.
You're going to be there.
Yes.
And we're going to have, and Kim's going to be there. And we're just going to have
Thank you so much.
Yeah, we really are looking
Is there
forward to it.
anything else that you guys?
No, I think that's pretty good, right? Yeah. Okay. Okay.
Oh yeah, what are you going to do there? Because we're making this an experience too, right? It's going to be interactive. Yeah.
We're going to do IV. Okay, sure. We're gonna do women's IV. Okay, all right. Okay. Okay, body mass. Yes, we're gonna do in body. We're gonna check muscle composition and fat composition, and it also shows your metabolism, and it shows what your goal weight should be. Not by BMI, which is like old. It shows what your weight should be according to your metabolism.
Oh, thank goodness.
Yes, it's a really good. Yeah, so maybe you're not actually. Depends on how much muscles you have. You might be in a perfect weight.
Well, I know. Kim and I, we lift weights.
We do.
Good for you guys. It's very important. It is the best medicine ever.
Really,
Right. Absolutely.
The women that are in the classes with me are much older, and I'm like looking at them like they're lifting heavy weights.
You gotta do it. Yeah.
I appreciate your time today.
Sure. Thank you so much. Thank you.
Yeah,
Thank you
thanks
so
for
much.
having
Thank
me.
you. Thank you. Thank you.
We'll see you at the Expo.
We'll see you at the
Thank you so
Expo.
much.
Thank you so much. Yes. Thank you so much.
Come spill with me. Come spill with me. Come spill with me.